Today I'm going to talk to you guys about epilepsy. According to the CDC, better known as the Central for Disease Control and Prevention, about 1 in 10 people will have a seizure in their lifetime. This speech is going to be about epilepsy, and I will walk you through the symptoms, diagnosis, and treatment/first aid of epilepsy. Let's first talk about the symptoms of epilepsy. According to the Epilepsy Foundation, even if a person is not born with epilepsy, they can develop it in forms of head trauma, disease, and many other things. And a seizure is simply an electrical misfire in the brain. People with epilepsy have seizures. Most of the time, they are the big, and they're called grand mal seizures, which they either shake, fall down, or faint. But there's many other types. They can be as small as eye flutterings, or fainting, or even just an angry outburst. Most people feel tired after they have a seizure and go to sleep. Now that you know the symptoms, let's talk about the diagnosis. According to the Mayo Clinic, one of the ways doctors can test to see if a patient has epilepsy is an EEG, which stands for I can't pronounce that word. It's a graph. They hook a bunch of wires up to your brain, and then they test your brain. They look at all the electrical fires in your brain to see if it's not usual. And a seizure is basically just an electrical misfire where it goes to a different spot and your brain just reacts completely wrong, and you freak out. Now that you know the diagnosis, let's talk about the treatment/first aid. According to the CDC, there are many different types of seizures. When people think seizures, they think of the grand mal, which I explained earlier. Those usually are falls, shakes, or jerking around uncontrollably. In this situation, you make sure the person doesn't fall. You want to catch them, and you want to place them down, and you want to put them on their side. And after you put them on their side, you want to actually time the seizure. If the seizure goes over 5 minutes, you want to call 911. You don't call 911 before that. People used to think that people, when seizures, if they died, they would choke on their tongue and actually die, and that's not true. And some of the treatments for seizures is medication, brain surgery, and even they put an electrical pulse thing, hook up to the vagus nerve, and when someone is having a seizure, they run a magnet over it, which sends an electrical pulse up to the brain that's supposed to stop the seizure. In conclusion, I hope the one thing you learned about epilepsy is, I hope if you take away anything from this, it's that you know what to do if someone's having a seizure. Know the steps, call 911, put them down safely, that's it.
Good.